I am State Senator LaTanya Johnson. I represent Milwaukee's North and Northwest Side, located in the 6th Senate District. I am so honored to have you here with me today as we dive into a lot of the disparities affecting our Black communities. So now we're going to get started on the presentation. Systematic racism and social determinants of health. All of the data that we'll be discussing next are the result of many factors known as social determinants of health. This includes social and economic disparities, lack of access and quality care, environmental quality, etc. Public policies play major roles and impacts these factors and impacts the factors that are contributing to discrimination, racial policies in our African American and BIPOC community. Historical racist policy exacerbates these factors, whether it be structural racism, like redlining or discriminatory lending practices, or simply lack of diversity among healthcare professionals. To address these disparities in our BIPOC communities, we must address the discriminatory policies that make them possible. Next slide. Systematic racism and social determinants of health. Now we are going to dive into some of those other factors that help to make Wisconsin one of the worst places to raise an African American child. We are going to talk specifically about Black babies in Wisconsin. So, Black babies in Wisconsin are 3 times as likely to die before their first birthday as compared to white babies. Specifically, the infant mortality rate in Wisconsin is 14.6 deaths per 1,000 live births for Black babies. That means 14 babies die for every 1,000 live births for Black babies, compared to just 4 deaths per 1,000 live births for white babies. Or we'll round it up and just say 5 deaths per 1,000 live births for white babies. And depending on where you live, for example, in 53206, it's 29 deaths per 1,000 live births. That is an issue. These numbers are alarming for infant mortality, and it makes Wisconsin the highest of any state in the nation at 30% above the national average, which is just 10 babies or 10 deaths per 1,000 live births. And that's based on the 2018 CDC data. Now, Black mothers experience 1.75 times the risk of significant complications from labor or delivery than white mothers, and are 5 times the risk of dying in childbirth from other complications. And that we're not just talking about young mothers either, we're talking about mothers across the board, Black mothers. And the fact that our babies are 3 times more likely to die before their first birthday is an issue. It lends credibility to why Wisconsin is ranked one of the worst places in America to raise a Black child. And the vast majority of our babies are not making it to their first birthday. And depending on what zip code you're in, that number can be significantly worse. Next slide. Now, in order to change the narratives around what we see and around those statistics, the state has to prioritize legislation that disrupts the discriminatory policies that directly impact our community. And so some of the things that Governor Evers tried to incorporate into the state budget to help address some of these issues are, for example, postpartum badger care coverage for new moms for 12 months, making sure that those moms have the opportunity to have those doctor's appointments and have some form of coverage. Now, the GOP did not exclude this out of the budget like they've done so many other things, but they significantly shortaged shorted the coverage period to just 3 months, and that's not long enough for those mothers to receive adequate care. Governor Evers also put $8 million in the Black Infant and Maternal Health Initiative to reduce infant mortality disparities. That was $8 million that would go specifically toward Black infant and maternal health initiatives. That was stripped out of the budget by my Republican colleagues. The other issue was badger care coverage for doulas. We know that doulas do a significant job in terms of targeting our parents and being able to be with them from the beginning of their pregnancy through the end. And studies have shown that doulas are also a significant cost-saving measure. Having those services provided by doulas is significantly cheaper than trying to have those services provided through doctors or inpatient care or other things like that. So that too was completely stripped out of the budget, which is just insane. I don't know how that could even be justified, but it was. The other thing is birth to 3 eligibility for lead-poisoned children. Now, this is extremely, extremely important because we know the impact of lead on our young babies. The birth to 3 programs provide early intervention and services to young children who are at risk, who have serious developmental delays, and changing the birth to 3 eligibility based on lead levels. For example, Wisconsin still goes by the 10 micrograms of lead per deciliter, compared to the CDC's recommendation or definition of 5 micrograms per deciliter. Now, if we changed that, just that one little blood level, that would allow an additional 2,000 children and families each year to receive services earlier, preventing further delays and improving their outcomes. That in itself was pulled out of the governor's budget. And we all know that lead is devastating in the city of Milwaukee. We have over 70,000 dwellings that have lead pipes, but even more so than that is the issue of lead paint. One of the things that we do know is that the order of the lead toxicity is the home, water, and the soil. So for those of you, I am in 100% agreement with community gardening and gardening in the backyard, but please make sure you use raised beds. Or if you are planting directly in the ground, please make sure that you plant items that you then have to kill, because Wisconsin, in particularly Milwaukee, has a lot of old housing stock, and the land can be contaminated. So the only way to avoid that is to make sure that you plant and raise beds. I, myself, and Representative Sheila Stubbs introduced the Birth Equity Package, and basically it provides an at-home wellness visit upon request within the first 7 days of delivery. And that's so important because we know that our moms that are at risk for infant mortality are also at risk for other things. So this provides a trusted eye and information inside the home to make sure that both mom and the baby are doing well, and to make sure that the environment is suitable for those for the baby and the mom as well. And what makes that significantly even more important is that we know that a lot of our low-income children are not making it to their 6-week checkup, and neither is their mom making it to their postpartum checkup. So we want to make sure that we get trained eyes in that setting for both the mom and the baby. Mandating insurance coverage of maternal mental health risk screenings is extremely, extremely important. Repealing Wisconsin's Medicaid birth cost recovery law. And what that is making sure that we are not going after these parents, and particularly the father, for the birth cost of the child. Sometimes that causes problems for the mom and can put both the mom and the babe in jeopardy and danger, and it does more harm than good. Also, establishing pregnancy as a qualifying event for employer-sponsored health plans and removing the sales tax on breastfeeding equipment and supplies. For a lot of our low-income families, the birth of a child is extremely expensive. So making sure that we can do everything possible to encourage that new mom to breastfeed. And also expand access to dental care for pregnant Badger Care recipients is extremely important as well. Next slide. Now we are going to talk about the lead pipes like the ones in Flint, threaten 70,000 residences in Milwaukee, 10,000 residences in Racine, 8,000 in West Dallas, 6,500 in Manitowoc, 7,000 in Kenosha, and almost 2,000 in Green Bay, and 3,000 in Shorewood. So to be honest, the lead pipe issue that we are experiencing in Milwaukee is not just reserved for Milwaukee. We have lead pipes all over this state. To replace all 70,000 lead pipes in the city of Milwaukee will cost roughly about $700 million, which is significant, a significant cost. And so making sure that we're finding the resources to replace as many of those lead pipes as possible is extremely important, but also understanding that the city at a $700 million cost will not be able to do that all at once without additional funding either from the state or the federal government. In fact, the children in the cities of Milwaukee and Watertown, for example, Milwaukee's lead level for children is 8.6%, Watertown 8.4%, Racine and Menasha have greater instances of lead poisoning than Flint, Michigan. Flint, Michigan had 4.9%, Milwaukee 8.6%. So you do the math at the importance of removing lead from both the water levels and from the home, because we do know that elevated lead levels cause significant developmental delays. And also for our pregnant moms aren't tested for lead. A child isn't first tested for lead until they're 1, and the testing typically stops at age 6. So there may be more moms and children out there that are experiencing lead poisoning and just haven't been tested. So that is something that we definitely want to keep an eye on, but we do know the significance of making sure that our kids who do have elevated lead levels have that taken care of. And also the importance of reducing those lead level numbers to the CDC recommendations of 5 micrograms per deciliter is extremely important in making sure that we're helping to save our kids. No amount of lead is safe, but we definitely would prefer the 5 milligrams per deciliter versus the 10. Next slide. Now we're going to talk about the systematic racism and social determinants of health and chronic illness. This was one of the slides or one of the sections that hit hardest home for me in some of the things that I was learning in terms of health disparities. So we'll just jump right into it. The CDC reports that in 2018, 6.8% of non-Hispanic white adults in Wisconsin were diagnosed with diabetes, compared to 12.5% of Black adults and 12.3% of Hispanics. In Wisconsin, Black women are 7 times as likely as white women to die from a premature stroke before age 65. And Black men are 4 times the risk of white men to die from premature stroke. The CDC data compiled by the Kaiser Family Foundation indicates that Wisconsin has the third highest racial disparity in the rates of death by stroke in the country. And I will repeat that. The CDC data compiled by the Kaiser Family Foundation indicates that Wisconsin has the third highest racial disparity in the rates of death by stroke in the country. Next slide. Now we are going to talk about life expectancy. So life expectancies is one of the best way to determine the health of populations. This is an extremely difficult slide for me because it shows the true disparities for Black residents in Wisconsin. So the disparities in life expectancy at birth in Wisconsin by race in 2018, white individuals live on average 15 years longer than Black residents. White residents live in average age to age 76. Black residents live on average to age 61. Asian Americans, 65. Native Americans, 62. All races combine an average age of 75. So if you are African American living in the state of Wisconsin, based on these racial disparities, your life expectancy is determined to be 15 years shorter than that of your white counterparts. Next page. This was also a shocker for me and just eye-opening when I read this in our Joint Finance Committee papers, and this was just something that I just had to make the community aware of. The CDC identifies HIV/AIDS, sexually transmitted diseases, also known as STDs, and tuberculosis as other health conditions that show significant racial disparities. In Wisconsin, Black residents represent just 7% of the population, but account for 38% of AIDS deaths. We represent 7% of the population, but account for 38% of AIDS deaths. The AIDS deaths rate among white residents is less than 1/12 as high as the rate among Black residents. This is the 47th largest Black-white disparity by state in the nation. I'll repeat that. This is the 47th largest white-Black disparity by state in the nation. The CDC also reports that Black residents diagnosed with HIV are less likely than other racial groups to receive care. Chlamydia and gonorrhea are also large racial disparities. In Wisconsin, Black residents have 10 times the risk of white residents of contracting chlamydia. Only Pennsylvania has a larger disparity. Again, Wisconsin Black residents have 10 times the risk of white residents of contracting chlamydia. Gonorrhea in Wisconsin affects Black people at 24.8 times the rate among white residents. This is 3 times the national average and is the largest disparity in the country. Gonorrhea for Wisconsin Blacks is 3 times the national average and is the largest disparity in the country. Next slide. There are also some other things on the last slide that I wanted to mention, if you can go back to the last slide for me. So in 2021, Milwaukee saw at least 255 cases of syphilis, more than the totals from 2016 to 2019 combined, according to the report by the Milwaukee Health Department. The outbreak follows a trend where an increase of 230 cases were reported from July 2019 to December 2020, and was the cause for concern among health officials. The Wisconsin Department of Health Services reported in 2021 that cases had risen 300% in Milwaukee compared to the pre-pandemic levels, with the biggest increase in women of childbearing age. The Milwaukee Health Department reported 6 cases of congenital syphilis, or babies born with syphilis, in 2021. Milwaukee had 5 cases of congenital syphilis in 2022. In an average year, 1 case is considered significant. And we were talking about in 2021, there were 6 cases and then 5 cases in 2020. So those were significant numbers. According to the report from the Milwaukee Health Department, roughly 66% of the city's syphilis cases were among Black residents from 2018 to 2020. That's roughly 66% of the city's syphilis cases were among Black residents from 2018 to 2020. This is compared to about 15% in both the white and Latina populations. Next slide. Opportunities for school funding. We are now going to talk about, in Wisconsin, while 1% of white children live in poverty areas, 35% of African American children live in poverty. Black children make up about 9% of the total Wisconsin public school students. Nearly 90% of Wisconsin's African American population lives in the following 6 counties. That and they're all located in southeastern or southern Wisconsin. So 90% of the Wisconsin's African American population lives in the following 6 counties: Milwaukee, Dane, Racine, Kenosha, Rock, and Waukesha. When looking at African Americans as a percent of the total county population, Milwaukee County tops the list with 25.6%. Milwaukee Public School has roughly 77,746 students, of which over 80%, or 62,000, are economically disadvantaged. 20%, roughly 15,223, have special needs. 54%, which is roughly 40,614, are African American. 11%, just 8,099, are white, and 27% are Hispanic. Next slide. So in 2019, Wisconsin's graduation rate for white students was 92.7%, and that's excellent. But compared to a graduation rate of just 67% for Black students, that's horrible. The gap in graduation rates for Black and white students is the largest in the country. And I will repeat that. The graduation gap in graduation rates for white and Black students is the largest in the country. Wisconsin also had the 47th highest gap between Black and white students in its share of adults with high school diplomas or bachelor's degrees. In 2000 through 2001, the number of bilingual pupils in the state increased by approximately 78%. However, the appropriation for bilingual bicultural aid increased by only 4%. There's a significant problem with that. Significantly more bilingual kids, but barely any increase in funding. And that is another example of why these disparities continue to just persist, because we aren't devoting enough resources to the challenges that our communities of colors face. Next slide. Some of the things that the governor put in the budget to address these issues was create a new equity payment to districts of $75 for each student who is from a family with low income. Now, this was extremely important to me because we all know that educational systems are not all created equal. Mequon's school system, a public school system, is not even comparable to MPS. So one of the ways to address this is to offer additional funding per student for every student in the low income bracket to help increase the amount of money that's available to help those schools and those students thrive. That was taken out by my Republican colleagues. $3 million for driver's educations for students from low-income families to make sure that they have access to a driver's license, which is becoming increasingly more important for employment. That was removed from the budget by my Republican colleagues. $28 million more over 2 years for English language learners in K-12, in our K-12 schools. We talked about how they saw, I believe it was a 78% increase in bilingual students, but they only received a 4% increase in funding. The governor proposed $28 million more over 2 years, and that was taken out by my Republican colleagues. In-state tuition for all graduates of Wisconsin high schools, regardless of their documentation status. That was extremely important and could have been a game changer. That too was taken out by my Republican colleagues. Next slide. Expanding Bucky's Promise. This was a favorite of mine and a true game changer. It would have allowed Wisconsin students with household incomes of less than $60,000 to attend any UW school tuition free. My Republican colleagues removed that from the budget as well. $760,000 to expand City Year to Milwaukee to more schools. That was removed. $5 million for the school breakfast program. We don't want to feed the kids, so that was taken out. $709 million for special education aid to the schools. Now, Governor Evers' proposal was cut by $624 million, which is a huge, significant amount, to only $85.4 million, barely enough to hold reimbursement rates level. But looking on the brighter side, thank God they just didn't pull out all the funding. The increase of $709 million for special need education, that also cut the governor's proposal by over $624 million. Next slide. Mental health. This is extremely important because we know that between 2016 and 2019, 14.9% of Wisconsin youth ages 12 to 7 reported major depressive episodes. Now, if you look at those numbers, after COVID, we're seeing those numbers significantly increase. Wisconsin 2019 Youth Risk Behavior Survey found that pupils surveyed, 49% reported high levels of anxiety, 28.5% indicated depression, 18.5% reported that they had engaged in self-harm over the previous 12 months. And we also need to mention that 12% of young adults age 18 to 25 in Wisconsin reported having serious thoughts of suicide. Also, our focus groups with Wisconsin parents highlighted the stress of meeting basic needs, accessing mental health and addiction support, finding spaces where their kids can be safe, included, and connected, especially for rural families and families of color. The factors to anxiety, especially younger and parenting adults, are experiencing extremely unusual high levels of stress and anxiety as well. More than half of mothers of young children, 51%, reported frequent or constant loneliness during this time as well. Next slide. This slide basically shows the level of depression and anxiety, um, suicidal ideation, and demand for mental health services in college students between the ages of 18 and 24, and how it is trending up. 66% of these individuals stress due to financial worry, 60% difficulty accessing mental health services, and 41% depression, and 40% witnessing race-based discrimination. Next slide. Governor Evers also put money in the budget for to address mental health. He proposed $54 million in funding for student mental health programs and support. The GOP cut this proposal by $34.5 million. He also proposed $9 million to the city of Milwaukee for a trauma response team. And that's so important with us seeing the increase in reckless driving and in homicides due to gun violence and non-fatal shootings. But of course, that too was stripped by my Republican colleagues. Next slide. So many times, and this becomes very personal for me, I hear people say, we elected leaders all the time and things never change. So it doesn't matter who is in office, things will never change. So I wanted to share with you the legislative makeup and the barriers to getting solutions to address some of the issues that we just talked about, especially those issues that are geared toward our Black and BIPOC communities. For example, Wisconsin has a split state government. Republican run the state legislature, and we have a Democratic governor, Governor Tony Evers. So of the 99 members in the state assembly, 61 are Republicans, 38 are Democrats. Of the 33 members in the state Senate, 21 are Republican and 12 are Democrat. One of the things that we continue to hear when we are talking about our issues and issues addressing our Black and Brown communities is that we don't have the money. The reality is, what they're really saying is we don't have the money to address your issues. This state is sitting on $5.5 billion with the B dollars. We have roughly $1.73 billion in our state's rainy day fund, $3.8 billion in our state general purpose revenue, which is known as the state surplus. With that being said, the majority rules. In the state legislature, the majority party decides when a bill will be taken up in committee, if that bill will pass committee, if it will make it to the floor of the assembly or the Senate. Now, with that being said, even the best Democrat with the most positive Republican relationships would still have to rely on majority rule in order to do anything to address these disparities. We've seen slide after slide how Governor Evers tried to address those issues, and my GOP colleagues took those dollars out. On the Joint Finance Committee, it is made up of 16 members, 12 Republican, 4 Democrats. The majority rules. So I guess what I'm really trying to say is with that majority rule bias, that it's almost impossible to do anything. It is impossible to do anything for those disparities without the help of my Republican colleagues, without the help of the majority. These disparities are getting worse. They are not getting better. Wisconsin isn't just the worst place to raise an African American child. We have seen slide after slide where we are the worst in so many other issues as well. Next slide. Wisconsin's financial landscape, when we talk about expanding Medicaid, 38 states have expanded Medicaid. What makes Medicaid so important to Wisconsin? Because expanding Badger Care would result in us covering thousands and thousands of additional people, but it would also allow an additional $1.6 billion of federal funding into the state. Remember, I said that the federal government, in terms of Medicaid, pays for 60%, we pay for 40%. This administration has been extremely creative in how we use those Medicaid funds to help with things like lead paint removal, to help assist with housing. A lot of those predeterminant things that we talked about earlier in terms of health. And so helping to expand Medicaid in Wisconsin could be and would be a game changer for Black Wisconsinites. Because it would be a path to funding, additional funding to help address some of those disparities that we're talking about. Refusing to accept those Medicaid dollars left $1.6 billion on the table. And if we can afford to leave $1.6 billion on the table because my Republican colleagues don't want to expand welfare, the state definitely isn't hurting for the funds needed to address those issues. Next page. Wisconsin's financial landscape in terms of family poverty. So this scale will focus on the blue, since this is Black History Month, but felt down, depressed, or hopeless. 23% of African Americans felt that way. Likely to lose their home. 39% of African Americans and 39% of American Indians, or individuals that are two or more races. Now, slightly no confidence in the ability to pay rent or mortgage, 31% of African Americans, compared to 26% of Latinas, 26% of American Indian or two or more races, and 12% of whites. Not enough to eat, 23% of African Americans, 23% of African American Indians, two or more races, 19% of Latinas compared to 10% of whites. Next slide. That concludes our dive into Black Wisconsin.